And welcome into this edition of ACAP Today for the week of April 5th, 2021. I'm Jason Parent with the Aroostook County Action Program. On today's program, a very special feature interview. We're going to be joined in just a little bit by Dr. Nirav Shah, the director of the Maine CDC, who's going to talk to us about how vaccination efforts are going in Aroostook County and about why now is not the time to let down our vigilance as it relates to the COVID-19 vaccine and proper protocols of social distancing and mask wearing and the like. We're going to talk to Dr. Nirav Shah in just a little bit, but before we get to that, we are going to get to this week's news and information that you can use for the week of April 5th, 2020. And we begin this week where we've begun most weeks, but with a little good news, light at the end of the tunnel, if you will. Our offices do remain closed to the public, but we have tentatively scheduled April 20th, Tuesday, April 20th, later this month, as the day that our lobbies in Presque Isle at the facility you're seeing here on the screen, and our lobby at our Holton Military Street facility in the non-early care and education section of the building will open. So we are looking forward to that date on the 20th of April. One of the reasons we are obviously continuing to serve individuals remotely. You can reach us by phone. You can also drive up to the buildings in Fort Kent and Presque Isle and in Holton. Fort Kent's buildings on Alfalfa Avenue in the industrial park. You can drive up there and there are video doorbells or otherwise instructions such as the phone number above the door that you can see in this picture here that you can call to get service curbside. We also want to let you know that one of the reasons why we're looking at April 20th as our opening date is that is the date when we expect a completion for the most part on our renovation at the 771 Main Street office facility. Things are coming along nicely and we do expect that the construction will be done in the next couple of weeks. So we are looking forward to reopening our lobby, our newly redesigned lobby for folks to come in and access services directly inside the lobby. We want to also let you know, and we'll be talking more about this with Dr. Shah in just a minute, but effective April 7th, so this Wednesday, all Maine residents aged 16 and older, I'm certain you've heard about this in the media, will be eligible to receive a COVID-19 vaccine. Appointment availability will vary and change rapidly, and so we're encouraging you to stay in touch with the news media to see what the latest information is. Now, that said, if you are under the age of 60 and you are in need of assistance registering for a vaccine appointment, if you're unable to go online and it's an online registration site, for example, please do give us a call at 764-3721. We are offering a free vaccination assistance hotline or helpline that if you can't go online for whatever reason, don't have internet access, or for whatever other reason cannot get through on the computer site, please do give us a call, 764-3721. We do ask that you be patient with the sites. We anticipate that the opening up of so many more opportunities for individuals to get vaccinated is going to be a challenge. So we want you to please be patient with that. But if you do need help getting online, give us a call again. You can also look at the vaccination sites that are available. We have them on our website for all of Aroostook County. You can also look at maine.gov/COVID-19/vaccines for information for sites across the state of Maine, and they continue to expand and continue to change each day. But again, we're happy to help you with that. You can also call the Aroostook Area Agency on Aging if you are 60 and over. They will help you connect with an appointment there. And then partners at the Aroostook Regional Transportation System will be able to help if you are in need of getting to a vaccine appointment and need transportation. They do require 24-hour in advance notice, so do call ARTS if you are in need of assistance with transportation to a vaccine appointment. We also want to take a little pat on the back this week to say congratulations to our entire ACAP team. Last week, we were named by Ascend at the Aspen Institute as one of the 2-Gen Level Up prizes. We've been working on the 2-generation whole family approach at our agency for about 4 years now, and these approaches really work with the entire family, and we were recognized for our efforts by being a Level Up prize recipient. It includes a $5,000 donation to the agency on behalf of Ascend at the Aspen Institute, and we are very proud of this and proud of our team, and thank you to our entire ACAP team for your efforts to help us attain this honor. It's really a well-deserved honor for everyone on our team, so thank you so much. We also want to remind folks, this is some important news, that the emergency rental relief program does continue. We've had over 500 renters in Aroostook County apply for this program. If you are having difficulty paying for your rent, or if you've had a household change in your expenses at all as a result of the pandemic, folks have obviously been paying more for groceries. The cost of gasoline has gone up. So if you're finding yourself paying more for things that are happening during this pandemic, and are having difficulty paying for your rent or utilities, now is the time to call us. You see the income eligibility guidelines there on the screen. So for example, a household of 4, if your annual income is under $53,850 as a household and you're a renter, you qualify for this program. If you're a little bit over that, please do give us a call, because there are some expenses like medical expenses that we are able to deduct from that. And we encourage you to give us a call to see about that program. The information's off of our website. It's also off of the Maine Housing website. You can find an application right online at the Maine Housing website. If again, you have difficulty and aren't able to fill it out online, we can certainly do that with you. Give us a call at 764-3721. It'll also help pay for utilities as well. So there's a utility assistance allowance. So please do give us a call if you think you might qualify. The Cinderella Project of Aroostook, very excited to announce that this is coming to Aroostook County for the first time, the Cinderella Project of Maine, in a partnership with Waldo Community Action Partnership, our own United Way of Aroostook here in the county, of course, ACAP, the Aroostook Center Mall, which has provided us a free space to launch the Cinderella Project, and Aid for Kids down in the Holton area, which has been also a very generous partner in this project. These are free prom dresses, and there will be some ties for the guys as well that will be available by appointment. Because of COVID-19, we are scheduling appointments for these. They're new and used prom dresses, and they're in a variety of styles and sizes. I was among the people. There are 578 prom dresses that came to Aroostook County last week. The Cinderella Project of Aroostook store will be opening up at the Aroostook Center Mall on the 18th, 19th, and 20th. The hours are listed there on your screen. Please note that we are requiring folks to schedule an appointment, so we can make sure that we have COVID protocols in place and that we don't have too many people in the store at the time. So you can sign up for your appointment at acap-me.org. There'll be a sign up place there, and we will be, of course, following all COVID-19 safety protocols. But do sign up for an appointment. It's the long Patriots Day weekend. It's the week heading into April break, so there's no school on Monday. So if you can't get a Saturday appointment on the 18th or a Sunday appointment on the 19th, the 20th is off from school day. So this is great for folks looking for prom season, looking forward to prom season, and hopefully we'll be able to have those. And again, we could not thank our partners enough, most notably Waldo Community Action Partnership, our sister CAP down in Waldo County, down in Belfast. Thank you for sending us the 578 dresses. They'll be free of charge and yours to keep if you come to the Cinderella Project. We also want to remind folks that the special healthcare enrollment period at healthcare.gov is now available to shop through the marketplace. In addition to those who have not before accessed healthcare.gov or health insurance on the healthcare insurance marketplace, we're encouraging all folks who are currently in the marketplace or who have a marketplace plan through a provider to contact us and work with Stan Targonski, our healthcare marketplace navigator, because starting the 1st of April, so starting last week, those who were already enrolled through the marketplace had some new tax credits. That probably means that you're going to get a better deal in terms of what you're paying for your premium. So please do give us a call. If you're not in and are looking for health insurance, or if you are in currently in the healthcare insurance marketplace, now is the time to reassess your plan and to look at what better offers might be out there and incentive pricing might be out there. Call Stan Targonski. The number there is on your screen, 554-4158, or you can email him at stargonski@acap-me.org, and he will be able to help you completely remotely. You can work over the phone, or you can work on a Zoom platform like this, and he will talk you through the process. We want to thank very much a new sponsor that's come on board for our community cupboard out here at 771 Main Street at our location in Presque Isle. State Farm Insurance, the Harvell Insurance Agency, is our partner for this month. Thank you to John and his team for your generous contribution that will help keep the community cupboard stocked for the month of April. We also want to note that there are community cupboards like ours at the Presque Isle ACAP facility located across Aroostook County from Madawaska and Fort Kent, all the way down to Holton and further south in the area. They are popping up all the time, and we encourage you, if you are food insecure and in need of quick access to food, to visit your local community cupboard. On the similar concept, our community closet project has expanded here at 771 Main Street in Presque Isle, our office near Walmart. There's a clothing closet just outside of our facility that's open 24 hours a day, 7 days a week. There are a number of coats in there. We still have some cold days and nights ahead, hopefully getting warmer soon, but there's also a wide array of clothing for children and adults that we're constantly receiving donations on and are putting out there. But please do visit, give what you can, take what you need. If you'd like to drop off some clothing, we'll certainly take the donation and we'll get them up for you, or if you'd like to hang them up yourself so that folks can select from them. But we do welcome donations, and we certainly welcome people in need who would like to access clothing from the community closet. Again, it's open 24/7. It's lit at night. It's just under the awning in front of our building in a little enclosure that's still open. So please do dress warmly or come and get a coat if you are in need of a coat while you are shopping. The Maine's Workforce Collaborative, including the Aroostook County Action Program, continues to offer workforce development sessions online, things like interviewing tips and tricks, making career choices, resume and cover letter development, and many more. If you are thinking that you want to retool for a new job as we are heading out of the pandemic, now is the ideal time. So please do consider calling us, and we will share the schedule with you. It changes from time to time, but they are offered statewide, and you'll be sent a Zoom link to participate in the workforce development session. They offer all of the topics on a rotating basis, so if yours is not coming up really soon, it should be in the relatively near future. We also want to say to folks that if you are out there and in need, if you're finding that you're suffering with food insecurity or there are other challenges in your household, but you're not quite sure where to turn for help, we have navigators within our agency that are here just for that purpose. Give us a call at 764-3721 and ask for an agency navigator, and we will help piece things together. We might be able to help you get federal government benefits or reach out to other programs and services, some within our agency, some outside of our agency, to get you the assistance. We understand that it's a complicated system sometimes to navigate, and that's exactly why our navigators are here to help. So call us if you are in need. And finally, in this week's news and information that you can use, something that we're asking for your help with. We are going to be part of the National Financial Literacy Month Machias Savings Bank campaign to celebrate and to honor the month. Starting on April 5th, so starting today, you can help vote for your favorite nonprofit, help win $5,000 to go toward our financial literacy efforts. There are 8 nonprofits, including ACAP. And it's going to sort of be like a competitive period where 2 will be knocked out each round, and we need your help. So if you are out there and listening, go to Machias Savings Bank, go to their Facebook page, go to their website, and vote for ACAP or vote for your favorite organization. There's not really a loser in any of this at all, because all of the organizations noted here are doing tremendous work. But we do need people to come back and vote daily, because 2 programs will be eliminated each week. So this isn't a one-time ask, it's a kind of a repeated ask. And through the month of April, the winners will be announced on April 26th. So we're hoping that you'll help us move forward and support some of our financial literacy and financial health initiatives here at the agency through this campaign. And that's this week's news and information that you can use. And as we mentioned at the top of the broadcast, we're pleased to welcome Dr. Nirav Shah back to ACAP Today. We last spoke with Dr. Shah on this program back in December and thought it would be time to catch up with him, because a lot has happened since December, Dr. Shah. And though the focus right now is certainly on vaccination, or as you said earlier this week or last week, in order to become vacation land again, we need to become vaccination land again. So talk to me about specifically the efforts and what you're seeing up here in Aroostook County.
Well, let me start with the great news, which is that the healthcare providers, as well as the folks in Aroostook County, are really embracing vaccines. Sometimes when we think about rolling something out like this, we really worry about whether there will be the capacity and the demand in rural parts of the state. Thankfully, though, Aroostook County has been at the top of the tables of all the counties in Maine in terms of the number of shots delivered and the percentage of the population who has shown up to be vaccinated. That's great news. And I'd like to take a second to commend everybody in the county for all of their efforts getting vaccinated. But we've got more work to do now. Last week, Governor Mills announced that anyone in Maine age 16 and over is now eligible to get a vaccine for COVID-19. That's great news as well. It literally means anyone who's over the age of 16 can get a shot for COVID-19. Now, we know that because we just made that announcement, it may be a little tough to get an appointment because there's so many people now who are eligible. What I'm asking folks today is to not give up on the process. It may take a while to get an appointment on the calendar, and that appointment on the calendar may be a couple of weeks away, but don't give up hope. If you call looking for an appointment and they don't have any, try back again. And if the appointment that you get is a couple weeks away, don't lose hope. At least you've got a spot. Make sure you keep that appointment so you can get vaccinated.
And I do want to remind our viewers out there, as they heard in the news segment portion of this program earlier, that ACAP is providing assistance for all individuals under the age of 60. The Agency on Aging is providing that assistance above the age of 60. But if you cannot get online for whatever reason and want to call us, we will help you book your appointment. And then we're also looking forward to, Dr. Shah, just so you're aware, we're working hopefully with a local pharmacy here and part of our vaccination effort here in Aroostook County to get a mobile unit out to folks in the coming months, because we understand that transportation is still a challenge in some of our more rural communities as well. So very excited to hear, Dr. Shah, about vaccinations, and obviously want to encourage people and join you in that course. I'm fortunate to have gotten J&J one and done, as I call it, as a result of our affiliation with the child care center here at ACAP. So very happy that that has happened, and my wife is as well, and our 16-year-old daughter will now be able to, so that's wonderful. So talk to me about the fact that we're talking about vaccination, but there's still the challenge and the concern of the vigilance about the virus itself. And what do we need to know about that?
Well, I'm glad you raised that, Jason, because there's great news on the vaccine front. As we mentioned, more folks are getting vaccinated. It's the right thing to do to keep your family safe. But at the same time, cases are going up. Last week in Maine, we had case numbers that we haven't seen since January. It's still concerning. I guess there's two things to say about that, Jason. The first is it's a reminder that we're not out of this yet. There are still cases that are popping up across the state, including in Aroostook County. The second thing, though, is that we're in a race. That's what's going on. We are in a race against the virus, against these variants of the virus, and with the vaccine on board. The goal for us as a state, as a country, is to outrun the virus. If we can get more folks vaccinated before the virus starts taking hold, we've got a great shot at keeping those numbers low. We don't, we could be looking at a really tough summer. Fortunately, because of who has been vaccinated, folks who are older, folks who are, as a result, have more medical conditions, we haven't seen a big increase in the number of folks who have died or who've been in the hospital. That could change. So it's more important than ever to get your shot. I know that there are folks who have questions about their vaccine. We're here to help answer those questions, but getting that shot is one of the best things you can do for your family right now.
Is there a magic number that you're looking for, a percentage of the population, or when are you, I mean, I don't want to say spike the football because that's an analogy that's been used a lot, but is there going to be a point in time or some data set that's going to say to you, okay, we're in a better place at this point?
Well, you're right about spiking the ball before or celebrating before you get in the end zone. It's not my style. I don't like to take victory laps because, again, we're still in this. But you asked the right question, Jason, which is, where are we going with COVID and how are we going to know when we get there? I look at a couple of things. The first is, how are we doing in human terms? Right? How are we doing in terms of the number of people who are dying, the number of people who are on a ventilator, the number of people who are in a critical care unit bed? Right now, those numbers are still pretty high. We want to try to get those as low as possible. So that's one metric. The other metric, though, is what are we doing in terms of getting back to day-to-day life? How are we able to get kids back into school? Now, kids have already been in school in Maine. We've been leading the way on that. But I think we all want more kids in more schools, more days a week. How are we doing on getting back to those normal rhythms of everyday life? That's the key right now. That's the reason we want to get vaccinated. It's not for some academic or abstract thing. We want to get vaccinated so we can get back to normal life. And that's what I'm also looking at in terms of how we're doing.
So when we're talking about the vaccine, there are still folks out there who are saying, my gosh, I don't know if it's trustworthy. And I'm shopping around for which vaccine I'm going to get because I feel like one might be more safe or one might be more tried and true than the other. What do you have to say to folks out there who are just on the bubble about this, who are resisting getting vaccinated?
You know, what I have to say is I get it, right? I totally understand why folks have concerns. A year ago, COVID was this brand new virus, and now a year later, we've got 3 vaccines for it. It seems like a lot. It seems like it was a lot of work in a short period of time, because we often hear that vaccines take decades to develop. So what's going on here? I understand those concerns. I want to answer them really quickly. The first, and I think the most important, is that it's true that these vaccines were developed in lightning fast time. That's because the entire world got together. The best scientists in America got together to figure out how to solve this problem. They didn't cut any corners. What they cut was red tape. That's how the vaccine was able to be produced so quickly. The other thing, though, is that I know folks have concerns about the vaccine. They may be a little scared of it. But you've also got to recognize that COVID itself is not something to be trifled with. COVID's a concern as well. And if you ask me which of those things I'm more worried about, the vaccine or the virus, I'm a lot more worried about the virus than I am the vaccine.
I know you've been getting out and actually being present at these vaccination clinics across the state. We'd love to have you come to Aroostook County, by the way.
We are working on it. My team is trying to find a time to line up some clinics where we can check in with folks, learn about how things are going on the ground, try to encourage as many people to come out and get vaccinated. So we are working on it. We're trying to get it together as soon as possible.
I can tell you from experience, our leadership team volunteered at the Northern Light AR Gold vaccination clinic here at Northern Maine Community College. Phenomenally run, and I actually had my own vaccine at Cary Medical Center, the J&J, and then both. I have high praise for both, and I've heard great things in the north and in the south of Aroostook County. So people are really embracing this, and I think the other part of it too is people are being treated first class. I mean, the CEO of the hospital is out to greet you with an umbrella on a rainy day to get you from your car to the facility. So,
well, you know, Jason, I'm glad you said that, and I too try to keep touch with Sean Anderson and Chris Duty, and I try to check in with them as often as I can to hear how things are going. But you make a really important point. We talk a lot about these mass vaccination sites, and sometimes people have an impression when they hear that term that it's going to be like cattle being herded. It's nothing like that. You're treated with respect. You're treated like a patient. You're treated like a person. And that's really important to encouraging folks to come in the door. I think of them as community vaccination centers. They're places where anybody in the community can go and be treated as a patient, as a person with respect, and get a shot that can actually save their lives. So it's a triple win.
I know that one of the best parts about volunteering at the vaccination clinic was actually seeing people again. It was just so nice to see people in person again. And I think a lot of people are asking, summer festival season's not too far along. We're hearing Lobster Festival in Rockland canceled. Potato Blossom Festival up here, I think we're still trying to hold hope. Acadian Festival, there's some really great summertime events. And if you live in Northern Maine, especially, you don't get out much in the winter. So I think folks are really missing that human interaction. Do you think folks will be able to come together in safe ways this summer for traditional festivals and events?
I'm optimistic, but it's not a promise. Right now, we are seeing cases rise in the state. So there's concerning signs on the horizon. But at the same time, vaccination rates are going up as well. Just last week, we had a day last week where we had over 20,000 shots in arms in one 24-hour period. So we're making progress. Jason, I'm an eternal optimist, and so I'm hoping that some of those festivals, particularly some that are a little bit later in the summer, have got a good shot. I can't promise that, though. We're going to have to wait and see what the data look like, what the safety of them are. But this is a good opportunity for folks, though, to connect these things. We all want that return to normalcy. We all want to go back to the summer of 2019 when festivals and community gatherings and barbecues or the norm. That's within our reach. And the way we get there is by vaccinating, right? That's the pathway that gets us back to the Potato Blossom Festival and all of those things that are staples of our summer. If you're on the fence about whether to get a vaccine, if the one thing that tips you into the yes camp is, hey, if I get a shot, that means there's less disease, and it means these festivals, which are great community and cultural and economic events, can happen. Hey, go for it. It is within reach, and it's up to us.
That's it. So get your shot so we can have a Potato Blossom Festival this summer. Let's make that happen, Aroostook County. Dr. Shah, I've got two last questions for you in this broadcast. One being the quantity of vaccine that's coming. I imagine that because of the decision that the governor made, there's some relative confidence that there's going to be a continued flow of vaccination coming into the state of Maine, so that folks will be able to get it. I know that obviously there's going to be backlog because of the massive folks that we've opened it up to, but fairly confident we're going to see the flow.
I am, Jason, but I want to say one important thing. You noted it at the top, which is, with the governor's announcement last week, it's an awful lot of people who are now eligible for vaccines, anyone 16 and over. So it's going to take a little bit of time. And although one of the reasons why the governor made this decision is the increased amount of vaccine coming into the state, even that might change a little bit. There might be some weeks where it's higher. There might be weeks where it's a little bit lower. I wish it were a one-way ratchet where it's only going to go up, but unfortunately, that's not going to be the case. There are going to be weeks where it's easier to get an appointment and weeks where it's harder to get an appointment. What I would recommend folks do is tune in to our broadcasts and check out our website. We post how much vaccine we're getting, and that gives you a pretty good idea of the availability of appointments. So there's going to be some ups and downs. There might be some bumps in the road because of how many people, but don't let that be the deterrent.
And then lastly, I think I'm asking this question a little bit in fun, and I know that it's not it's not something you sought, but you've kind of gained a celebrity status within the state of Maine. You're kind of the pandemic rock star, if you will, kind of like the state of Maine version of Dr. Fauci. I think people are calling the vaccine nationally the Fauci ouchie. Are we calling it the Shaw shot yet in Maine?
I have heard that term, and I neither endorse it or unendorse it. It's let me mention this, Jason. I'm a guy who moved to Maine not even 2 years ago, and I didn't grow up here. I grew up in the Midwest. I've got a funny name, and I'm from away. And within that time period, it's really gratifying to see that in a lot of places in the state, my team, the Maine CDC, which I have the honor of leading, has come to be able to be seen as a source of truthful, scientific, and non-political information. I think that says a lot more about the people of Maine than anything else. And I'm pleased to say that support has come from north to south, east to west, including folks up in the county. And again, I think that speaks a lot more to the character of people in Aroostook County than anything else.
So no breaking news that we're going to be seeing Shaw for Senate posters anytime soon.
No, I'm staying. I'm a public health guy, and that's where I'm staying.
Great. Well, thank you so much for joining us. And I said it in December, and I'm going to reiterate it again. And it sounds like we might be inching closer. Really looking forward to being able to see you in person in Aroostook County. I think you'll enjoy this part of the state. And as you pointed out, we're doing something right with vaccinations. Actually, I'm calling it in this part of the state. My colleagues from CAP agencies, every one of them have known someone who's come to Aroostook County to get their vaccine. You said that it's got to be vaccination land before it's vacation land. I think Aroostook County actually has vaxotourism going on in this part of the state. So
hey, let's go with it. If that's what it takes to get folks their shot and to visit the county, then it's a double win.
If it's their first visit to the county, I'm hoping they're coming back because there are better times ahead for all of us. Dr. Shah, thank you so much for joining me on ACAP today. It's been a pleasure again, and again, I look forward to meeting with you in person someday. Thanks.
Thank you, Jason.
And before we leave you on this edition of ACAP Today, just a reminder, if you are interested in looking for a career with ACAP, we certainly would love to have you apply for a position. We currently have case manager and family coach position for somebody who has a social work degree in the Madawaska area, Madawaska, Fort Kent, Van Buren, to serve the St. John Valley. We have a staff aide position in Holton and an Ed Tech 2 or 3 position in our Holton office, and other positions that will be posted soon. So please keep an eye at acap-me.org if you are interested in potential career with ACAP. We also want to remind you to connect with us. 764-3721 is our phone number. info@acap-me.org is a way to reach us by email. acap-me.org is our website, and it's a great resource for you. Our Facebook page also has lots and lots of information posted daily. It's a great way to keep track of what's happening and what services are available and programs are available to you. We also have a YouTube channel where you can see this broadcast if you want to watch it again, or other other webisodes of ACAP Today are there as well. And lastly, we are also on Twitter. And with that, one last thing, as always, our snapshot of the week. And this one is of yours truly. This was taken at the Cary Medical Center vaccination clinic, where I received my Johnson & Johnson vaccine. I am vaccinated and I'm wearing my sticker with pride, as you can see there. Thank you to the folks at our healthcare organizations across Aroostook County for this vital service. You're all doing fantastic, from our federally qualified health centers to Aroostook County's 4 hospitals, to the pharmacists and the local pharmacies and the national chain pharmacies and grocery stores. Everybody's pitching in to get the job done. And I am pleased that I am able to tell you that I am now vaccinated, and I want to say thank you to the fine medical professionals for making it an effective and efficient process. Thank you all. And with that, if you have not gone to sign up to get vaccinated and you need help with that, please do give us a call. If you have, thank you so much. But now is the time, if you're age 16 or older, to sign up for your vaccination. There's no excuse. Give it a shot. Take your shot. It's worth it to protect our friends and family and neighbors, and to hopefully get life back to normal in Aroostook County. With that, I'm Jason Parent with the Aroostook County Action Program. Thank you so much for joining us. We'll be back next week with another edition of ACAP Today. Stay tuned for that, and we'll look forward to seeing you then.